Okay. Hello, everyone, and thank you for being here this afternoon. My name is Amanda. I'm the Senior Wellbeing and Engagement Strategist with Motion Connected, and I'm here with Dana Baer, Director of Strategy and Partnerships with Mental Health America of Sheboygan County. We'll give just another minute or two for individuals to come on in and join. And we want to keep this webinar, as we have through our full Great Culture series, very conversational and open. We learn best from each other. So any feedback that you have, questions, comments, please feel free to drop those into the chat box or the comment box, and we'll try to address those in real time as well. So we'll go ahead and get started. May is Mental Health Awareness Month, which is a great time to, of course, discuss mental health. It's always a great time, but we're so happy to have Dana today. And what we have seen, let me just go ahead and switch this up. What we really have seen, if there's any silver lining in coming out of the pandemic, is this greater awareness in mental health and mental well-being overall. So when we talk about great cultures, when we talk about what a great culture is at an organization, and we touched on this in our last webinar series, it's really one where employees feel connected, where they feel safe, and where they feel supported. And mental health absolutely plays a role in all of those touch points and all those concepts. So just to back up a little bit, Motion Connect is an employee experience and well-being platform. We provide practical, easy-to-use solutions that support whole person well-being, increase engagement, and improve health and overall productivity, while also being very accessible for all participants, regardless of location, category of employee, or even spouses. So we really try to create a positive employee experience, and along the way, create those well-being nudges and promote a culture of healthy living. So today, with Dana, we're going to go over the Mind the Workplace report, which Mental Health America puts out every year. And then we're going to discuss how we can meaningfully support employee mental health in 2022. So we've learned a lot over the past 2 years. There is greater awareness in overall in mental health. But what does that mean today? Because it's not just an EAP. It's not just fill in the blank. It's not just a wellness program. So how can we get beyond that and really get into what works best for the employees? And then we'll finish up by reviewing current trends and best practice initiatives that make a real impact and a positive impact on employee mental health. So thank you, Dana, for joining us today. Dana is part of Mental Health America in Sheboygan County, and she joined MHA about 5 years ago. She was on the board of directors. Last year, she was board president. She holds a bachelor's degree in community engagement and education with a minor in psychology, focusing heavily on community-based nonprofits and advocating for change through community-organized initiatives and partnerships. After spending most of her career in the corporate world, she decided to pursue her passion full-time at MHA. So Dana, thank you. And we're going to start by talking about the Workplace report. So Dana, what is this report, and can you give us a synopsis of the main takeaways?
Yeah, definitely. And thank you for having me here. I'm really excited to be able to discuss the report and how we can improve mental health in the workplace. So the report, as you mentioned, is something that MHA National does annually, and it's an annual work health survey. They survey over 11,000 US-based employees across 17 different industries. and discuss their shared experiences with different mental health supports at work. So this report really highlights the need for leadership to reduce and ideally eliminate the tremendous amount of stress and kind of burnout that workers are facing because of kind of if there's a lack of the necessary conditions for active and positive engagement in the workplace. So as this slide shows, some major takeaways are that, as I think a lot of us know, that rates of stress and distraction are remaining high across workplaces and across the different industries that were surveyed. Managerial support really correlates strongly with employees' feelings of empowerment and positive mental health outcomes for employees. And then mental health awareness is increasing, and as we talked about, these last 2 years really have highlighted the need to focus on mental health and make it a priority, not just in our personal lives, but in the workplace. But we're also seeing that the likelihood of employees seeking out help that they need for mental health does have some room for improvement. So while sometimes there are the resources there, it doesn't always necessarily mean that employees are seeking them out.
Mm-hmm. Mm-hmm. That's interesting. And when you say the rates of stress and distraction remain high, we actually talked about this in a previous webinar with Dr. Lynn Wagner, and she was just talking about how they're even higher today than they were necessarily in 2020, you know, and that what we have gone through and people are at different points today than they were certainly 2 years ago, but it's continuing to have a really high impact on our overall health and well-being.
Yeah, definitely. And going on to the next slide. So in talking about distractions, so distraction and stress is lower and obviously the healthiest of workplaces. The rates are high across most of them, and it's found that 80% of employees agree that their stress from work affects their relationship with their friends, family members, coworkers. So, you know, that stress is really carrying over and overlapping in all areas of their life. And 71% of employees are saying that they find it difficult to concentrate at work, compared to 65% in 2021. So it's increased even from last year, and then only 46% in 2018. And we know that distraction is often a byproduct or kind of a symptom, I guess, of anxiety and depression. So, you know, and we're seeing those rates also increasing. So, I mean, there's definitely probably some correlation there. So, stress levels are sometimes coming from work, but, you know, it also might be related to anxiety or depression that an employee is experiencing. And sometimes it's not related to work. So, you know, a lot of employees have children, and we're seeing that children's mental health is really a concern, and a lot of parents are worried about their kids' state, and you know, that's going to affect them all areas of their life. They can't just shut that off. So recognizing and acknowledging that, you know, as management and upper level leadership, if that can be at least acknowledged and kind of understood, and that there's a shared human experience in that, because you know, most of us have in the workplace have children, or at least know people have friends with children, and can see that that's a big stress right now. So rather than just pretending it's not there, to at least acknowledge it is really important and can be beneficial in itself.
Absolutely. And we'll talk about leadership more a little bit further in the webinar, and just the importance that it has in really promoting a mentally well organization.
Yeah, we'll go into that a little more. And actually, just going back to that last slide quickly, the employees also in the unhealthy workplaces, just acknowledging the statistic about looking for new positions. So those, we're seeing a lot of, you know, transitioning in workplaces too, and employees in unhealthy or, you know, non-supportive workplaces are more likely to seek out different jobs or professional opportunities, and 56% of all surveyed employees have spent time looking for other positions compared to 40% in 2018. So, we're seeing a lot of these different shifts, whether it's in mental health and whether it's in, resignation, the great resignation that we, people hear about. So to kind of help to get rid of that cycle of resignation, employers can start looking at sort of that inclusive, person-centered approach to mental health care, and realizing that, one size doesn't fit all. So really a truly effective mental health strategy supports the different ebbs and flows of emotional well-being and solutions for employees who are struggling and those who are coping and some that are doing well, so having options for all stages of mental health is really important, and one of those things that can make an employer stand out or a workplace stand out.
Absolutely. And Dana and I were talking briefly before the webinar started, is that it's not beneficial to put all these resources out when employees are in crisis or in crisis mode, or when the time is almost past. It's more about the prevention, right, and that ongoing conversation.
Yep, definitely. And yeah, we want to have, we obviously want to have those resources for someone who is in crisis, but we want to not just address it when it's at that point. So yeah, looking at this next slide here, managerial support strongly correlates with employee empowerment and positive employee mental health outcomes. So 59% of employees report that their manager cares about their personal well-being. While that's over half, 59%, it still, leaves a big room for improvement for employees to feel like their managers really care. So about half of the healthiest workplaces encourage PTO usage as a management expectation. So really making that part of the culture that you're expected to take that time off. About 58% of employees disagree that their managers encourage them to take time off. So there's kind of a discrepancy in how maybe managers are perceiving what they do and how the employee is perceiving what they do, but really making sure that it's highlighted that that PTO or that vacation time is there for a reason, and employees should take it. And I think kind of having those regular reminders is really important too, versus, maybe at the end of the year, towards the end of the year when there's a reminder sent out that, you only get 5 days at rollover or something like that. But throughout the year, reminding that it's important to take that time off, and also having, kind of leading by example when we're discussing that too. And something that I heard of leadership doing at an organization recently was someone had said, like, it was a manager, and they said, I'm going to be taking a day off, and I'm taking it for a mental health day. So it wasn't just saying, I'm taking a vacation day. They actually stated that they're taking a mental health day. And then when she returned, she shared some pictures of she went for a hike, and actually showed what she had done to kind of restore and recharge from that mental health day that she took. So kind of normalizing it and making it part of the culture, because I think there is like a fear that there's still that stigma. There's been a stigma surrounding mental health for a long time, and I think that's breaking down slowly. But I think especially if you're not in management or not upper level, you're always maybe a little cautious of how what you're doing is being perceived, or how is this going to reflect upon me as an employee. So having management show that they're practicing these things too is really important.
Absolutely. And I think the key, what you said, Dana, is normalizing the conversation and normalizing the behaviors, and that they're necessary. We even had a emotion connected client earlier this year hosted a challenge that there was an incentive or a prize raffle, but in order to be eligible for that incentive or that reward, you had to take a PTO, 2 PTO days each quarter. Otherwise, you wouldn't be eligible for the raffle. So even just having, again, normalizing taking that time off, that it's there for a reason and encouraged.
Yeah, and I think like if you take an analogy, if say you have maybe like a running club or some sort of fitness club at your workplace, if someone showed up and had sprained their ankle or broken their ankle and they said, okay, I'm gonna go for my run with you guys, all those people would say no, like you need to rest, but I think often when it comes to mental health, it's just not discussed. But if you knew someone was really struggling, you would encourage them to take that time that they need. So I think as we're kind of talking about, the more that we discuss this and it becomes more normal and understood that mental health is just as important as physical health, and we hear people saying that, but I think it really needs to be integrated into the conversation a little bit more in order for it to become part of the culture.
Absolutely. Absolutely.
So back to some more of the stats on the slide, the level of agency that an employee experiences within their role impacts their workplace stress, leading to other mental health concerns. So we found that 2 in 3 employees are not comfortable providing feedback to their manager about their performance, which is pretty significant. And then 57% of employees cannot or feel they cannot negotiate responsibilities or their workload with their manager. So creating space for that open dialogue and management, really showing employees that they welcome and incorporate that feedback is really important for creating that sort of culture that is really collaborative and where employees feel that they do have that sort of level of agency and ability to speak their mind. So, it's a hard practice to really talk about, because it's something that, managers really have to do is listen and then, acknowledge what employees are saying and showing how it's being incorporated into what they're doing. So mental health awareness is really increasing, but the employee comfort levels about seeking out workplace resources isn't, as we mentioned earlier. So I think management also talking about the resources that are available, even if they don't have, employees aren't necessarily comfortable going out to their manager and talking about their workplace stress. If managers can more regularly talk about the resources available and at least kind of acknowledge that they're seeing what's going on, I think that will help open up the dialogue a little bit more.
Absolutely. Absolutely. So before we move on, let's go ahead and launch our first poll. Does your employer provide mental health benefits? So this is a yes, no, unsure, just one answer. And we'll go ahead and launch this and give it about a minute or so. And then we have a follow-up question for those that answer yes. So, does your employer provide mental health benefits at your workplace? Okay, we'll give this about another 10 seconds or so. Those are coming in. Okay, wonderful. So 100% of those that responded said yes, which is amazing.
Yeah.
That's fantastic. That's that's more than I thought. So let's go into this further. What type of benefits, mental health benefits, does your employer provide? And you can answer as many of these that apply. So employee assistance program, increased social support, connectedness, employee resource groups, behavioral health provider, either on-site or access to one, a whole person focused wellness or well-being program. Apps are mindfulness, Headspace, Calm, there's a bazillion. So what does your employer provide for mental health resources or overall benefits? Okay, the vote's coming in again. You can choose more than one, and then I'll go ahead and close in and show the results of this poll. Give it about 2 more seconds for any responses. Okay, wonderful. And let's go ahead and share the results here. So very interesting. 92% provide an EAP. Dana, in your experience, is that a higher number than typical?
I mean, that's pretty high, so that's really good.
Yeah.
I'm looking at some of the registration lists. It looks like, larger companies typically almost always have an EAP. Some of the smaller ones don't always have them, but even like the nonprofit that I work at, we're an affiliate and a little bit smaller, and we do have an EAP. The benefits of the EAPs can vary greatly, but it's really good. 92% is definitely a good statistic.
Absolutely, for sure. Okay, and next up is 88%, or I'm sorry, 83% have a whole person focused wellness program, followed by assortment of apps, increased social support, that connectedness is so important, or ERGs, and then a behavioral health provider. Okay, so that's interesting, and that can help frame our next conversation. Now, hold on, let me go back. And
that's great. I mean, the behavioral health provider actually being on site is a really great benefit. It's which is not very common, and it'd be amazing if most workplaces could get that. But as we were discussing before, that's the capacity is kind of an issue around in all different regions and areas of the country. So it would be difficult to have that, but I think that'd be amazing because some workplaces have like a nurse or a physical therapist on site, so to have a behavioral health worker would be great.
Absolutely, absolutely. At my former workplace, that was always my goal. Like that was something that would be just such a support, support. Okay, Dana, are you seeing the next slide? I want to make sure I'm off.
Yes, I am.
Okay, awesome. Okay. So moving on. Go ahead, Dina. I won't interrupt.
Sure. Yeah. So talking a little bit more about some of the ways we can implement making mental health and mental wellness a priority in your workplace and in your culture, and how to support that. So this lists just some simple, like high level steps. Understanding your workplace culture, and I think that culture is it's a term that we use a lot, but really, is it a good culture? And understanding the culture is really important, because is it really a deep culture if it's a good culture, or is it more of those sort of material like frills, which I think are great, getting some of those perks and like maybe little gifts here and there, or having a gym is great on site if you're working in an actual physical workplace and things like that. But really looking at like the culture of the mindset of the employees and the management, and does it align? Are there shared values and belief systems and attitudes in the workplace? Do people have the same assumptions about those values? Is it discussed on a regular basis? I think that's really important when we look at culture, and making sure that we go back and look at what the values and the mission for the organization are, and helping employees understand how they can connect to those on a personal level is really important in really making a true good culture. And something to think about when thinking of culture is, how does your culture encourage or discourage taking advantage of mental health support? So when thinking of mental health and the culture at your workplace, you want to look at, is that regularly encouraged to take advantage of those things, and not just when there is a crisis or a time of higher stress? So we saw a lot of workplaces highlight what mental health benefits they had, back in, like, say, April of 2020 or so. I know a lot of workplaces where I worked at the time they provided a subscription or a discount to Talkspace, or, you know, and you reminded us of our EAP and things like that. But we're seeing also that workplaces are kind of they're kind of stepping away from that now, because things are settling down a bit. And, you know, I think that maybe it's just not as highlighted, because there isn't, you know, a crisis per se, where, you know, the whole world just shut down. So we obviously know that there's going to be some effects of that, but just because things are going back to quote unquote normal a little bit, although it's not really going to be the same as it was before, it doesn't mean that those effects aren't still there. You know, just as if there is someone who had a childhood trauma, experienced something very traumatic in their childhood, we know that that affects them throughout their life if it's not dealt with and resolved. And what everyone just experienced with the pandemic is it really a collective trauma. So people are going to be experiencing the effects of that, the anxiety, the depression, the stress. I mean, that's not all just going to go away because we, you know, go back to in-person events and in-person work and things like that. So I think it's important for workplaces to keep in mind that we still need to keep a focus on those mental health resources and continue to encourage people to use them, whether or not they're in, you know, a crisis stage or just kind of a maintenance or even a, you know, really thriving stage. It's important to do that throughout. We don't, you know, work out only, you know, I mean, some people just work out when they're trying to lose weight or for an event, but the healthiest lifestyle is really to continuously, you know, stay active and exercise all the time, not just for some specific event or reason. So it's the same with your mental health. You really should be focusing on it all the time and maintaining those things.
Absolutely. And I think what you just said is so important for us all to recognize, is that it was collective trauma, and that even if we're functioning more out in society, whatever the now normal or new normal is for us, it didn't, that stress, that anxiety didn't just disappear, especially if it's not dealt with. You know, the same analogy from the child and the childhood trauma, it needs to be dealt with, right? It needs to be addressed.
Right, and then we're also all, you know, like the youth too, like youth are experiences a lot of heightened rates of anxiety and depression, and you know, that's something that I think everyone's or most people are worried about. And it's the same, that's not just going to go away because, you know, they're back to maybe their normal sports and their normal activities. It's still there, and it's also processed much differently for youth as well. Like what, you know, what just occurred and how they went through it is much different perspective than how adults went through it. And so parents are then also trying to help their children. And it's just really important, I think, to recognize that we still need to focus on our mental health, even though, you know, we're kind of easing back into a different phase of this. But so moving on to number 2, listening and understanding to coworkers and employees' needs. So, I mean, that kind of goes back to the culture too, I think, and what we've already discussed, really just having that practice of truly listening and incorporating what suggestions are being given. And even if it's not listening in an explicit way, even listening, like management could listen to how employees are interacting with each other, interacting in meetings, you know, their responses, their tones. You can kind of gauge, you know, how burnt out an employee may be, or the workforce in general might be, by really listening to the tone of the conversations and how people are communicating in meetings and things like that. And you know, that can help you be proactive about, you know, if you have to address an issue rather than something happening and kind of blowing up and then having to deal with it after the fact. And I'll talk a little bit more about kind of some of the burnout things to recognize, but I think we all know that people have felt burnt out and in the workplace, and that's due to a whole list of different things kind of compounding on each other. But it's important to listen, not just, like I said, to the explicit words being spoken, but just kind of the way that people are talking to each other. And then something I think you had listed in the poll there was considering or what workplaces have an ERG, employee resource group. So sometimes they're also called BRGs, business resource groups. It's pretty similar. It's a similar thing. It's a group of employees who come together with basically common interests, perspectives, and experiences around a certain topic. So there's often ERGs or BRGs focused on ethnicity or gender identity, special interests. Sometimes there's like veterans ERGs and women's ERGs and different things, but having a mental health focused ERG is something that I've seen in becoming more popular in workplaces, especially some in our area here, because we often have the ERGs ask us to come in and give some sort of presentation, or we had a larger corporation here with a mental health focused ERG, and we came and did a facilitator training for them. So they were interested in beginning to implement some peer support groups at their workplaces. So within the company, they were interested in starting mental health support groups. So where, employees would just come and have discussions about mental health. And so we trained them on being a facilitator. So some of those members of the ERG would facilitate those support groups. So that's something really that you can, if you really want to integrate that mental health culture into your workplace, having things like that, because it really empowers employees, and gives them the feeling that they have, some control and some, a level of influence really in the workplace and over their mental health. So doing things like that are really important, as well as like number 4, it says connect with leaders and find ambassadors. Something else that we have in our local workplaces are mental health ambassadors. So we actually have them in schools, so with teens, and then with adults in workplaces. And they really are just individuals that have an interest, an extra interest in mental health and sharing mental health education. So we will kind of help facilitate with them and provide some resources, and they kind of disperse that throughout the workplace or their school. With the youth ambassadors, we have a council actually. So there's a group of youth that are kind of that council and leading group of teens, and then they come up with different initiatives and things like that, and sometimes facilitate different presentations. We just had one talk about body image and eating disorders, so we had someone from our organization come and speak with some of them. But that again, it can be applied in a workplace or in a school setting, but being able to give some of that freedom and to develop some of these things, and then it really starts, it's kind of surprising and pleasantly surprising how quickly it can spread, and people become interested in something like that, just because it's mental health is it's not, it doesn't discriminate to a certain group, and it's not like a specific topic like a certain sport where only certain people have an interest in it, or it only applies to some people. Everyone has mental health. So the more we start kind of talking about it and having events surrounding it or activities surrounding it, becomes more normal to talk about, and it really just becomes part of the culture.
That's amazing. And I love that. I have not heard of a mental health employee resource group, but that is so impactful. That's wonderful. Mm-hmm. as well as those the teen ambassadors and facilitators and leaders as well.
Yeah,
absolutely.
Yeah, so that's it's a really great program, and it really could be implemented at any kind of size of workplace. And it really helps kind of just improve the morale, I think. And so the one that we are kind of associated or helping facilitate is called Heads Up. So they're just all focused on mental health, and it's really great. And they hold different fundraisers and things too. So I would strongly recommend forming one of those, or kind of trying to get a group together. I will talk about a little later in the presentation. That's actually something that we help with too, is kind of helping to establish a business resource group. And if employees never have had any experience with that, how they can go about doing that.
That's wonderful. Wonderful.
Yeah, so moving on to the next slide. Because each employee population is very different, there's really no true handbook for having a fail-proof strategy for positive, a positive culture and positive workplace. But you know, finding the right mix of tools is really trial and error for your specific workplace. But if there's one piece of advice, it's to really holistically look at things when building a mental health strategy. This is really the best way that you can ensure that leaders are meeting diverse needs and bridging any gaps that are in the workplace for mental health resources and services. But that generally there are some, you know, common conditions for active and positive engagement. So listed here, mutual trust and respect. It seems kind of common, but it's, you know, when you really take a look at workplaces and how things are, you know, meetings are being held in larger groups, especially when that can kind of start to crumble. So really keeping an eye on that, having stability, security, and safety. Something that we saw too when people started going back to in-office workplaces, it was a struggle for some people. And some people really liked it because, you know, they missed that social aspect, but the people that were maybe a little more introverted or maybe felt a little bit more potentially discriminated against in the workplace, you know, it was kind of psychologically safer at home for them because they weren't having to face all these maybe like microaggressions or sort of passive aggressive comments and things like that that they had in the workplace. So going back was a little bit more anxiety inducing for them, and they felt, well, I can just be safe, you know, in my home office. And so making sure that, you know, everyone feels a sense of security and safety, and that respect is really pervasive across the workplace, and addressing any of those issues that come up, because you know, it's often those people that don't really speak up or say anything that are maybe being affected. And yeah, we just want to make sure that things aren't falling under the cracks or in between the cracks, and making sure that that safety and security is there. And then also having a sense of purpose, of course, kind of going back to the values and mission of the company, and making sure that you can have ways that your employees can connect personally their values to those values. You know, and if they really are strongly misaligned, then maybe it isn't the best workplace for that person. But I think often it's just really finding those connections where sometimes that's missing, and so working on connecting that and giving employees a sense of purpose and a sense of efficacy. So, you know, and making sure that they feel that they are doing what they need to be doing, and providing the guidance and acknowledgement that they are, you know, on the right track and meeting expectations. And then if they're not, how can they, you know, help giving them, you know, a roadmap to meet those expectations, versus, you know, just not talking about it, because that really makes for a kind of broken lines of communication and broken trust between management and employees. And then the ability to speak truth to power, and we've kind of discussed that too, you know, making sure that employees are comfortable talking to their management about whatever their concerns are, is really, really critical, and for making a good employee culture. Because, you know, I think that the more quiet that employees are, the more concerned that management should be, because that means that maybe they're feeling like they don't have any reason to speak up. And you really don't want that in a workplace.
Absolutely. That brings to mind, I listened to a webinar yesterday on mental health, and the doctor was discussing managers and management training, but also highlighting the need for managers to know their people and to know them at a baseline, so that when there is, you know, a difference, whether it is becoming more quiet or working in intensely more hours or more intensely, if that's a change that might trigger, be triggered by something, there may be an issue there. So just create that sense of being able to speak the truth, for sure, and managers having a sense of their people and what's going on.
Yeah, and noticing if maybe they're disengaging in a way that they haven't before. That's a big sign to recognize that something might be going on either at work or personally, but either way, having some sort of just, having a conversation with that employee to see what might be going on or might be happening. And that really just shows that, again, your leaders care about you, and they want to know. They aren't even just waiting until you come to them with a problem. They're being proactive about it.
Absolutely.
So on this next slide, this one just looks at some questions to really ask yourself when looking at how you're building that mental health strategy and culture at your workplace. So how does mental health support fit into both your DEI and B and total well-being strategies? So diversity, equity, inclusion, and belonging. I kind of mentioned before about how going back to in-person work or in-office work has caused anxiety for some people, and that kind of fits into that a little bit too. If there's different groups of people that aren't feeling included or like they belong in the workplace, that's going to be a bit harder to go into that physical workspace. But even virtually too, you want to make sure you're having that, because it all lends together when it comes to mental health. Feeling that sense of belonging and inclusion is important for positive and good mental health. And then something else is to ask who has access, and are there certain segments of your workplace population that don't have the support they need? And this often applies to maybe different companies that have like kind of a more corporate side and a more industrial or manufacturing side. Sometimes the messages aren't dispersed in the same way. Some people are at their emails all day and seeing all the things that come through, and some people don't really look at their email that much. So just making sure that you're being aware and cognizant of how different employees are receiving different bits of information, and making sure that you're dispersing in different ways so everyone knows what's out there and available to them. Is support easy to find and navigate? So looking at your EAPs is one area to really look at that, because that's typically a third party, or an outside company. And regularly maybe checking in with employees or even the EAP company with getting some statistics on how much it's being used and not who specifically, because you want to keep it anonymous, but like what are they getting, looking for legal help, looking for mental health support, because there's different factors of an EAP, but making sure that you're getting positive feedback on that company, because I've heard a lot of different negative stories from employees about EAPs. They've reached out because they were in some sort of crisis, or if not crisis, just some high stress situation. They're looking for a counselor, or maybe it is legal support, but they had to wait a really long time to even hear back from somebody. So sometimes you can't control how quickly you can be seen by a therapist. It might be a wait, but they weren't even hearing back or getting any sort of status. So making sure that the EAP that you have is effective and providing good service and support to your employees, because chances are your company is probably paying a lot of money for that. So you just want to make sure it's a good one. And then other supports too, are they easy to find and navigate? Is it easy for an employee to see what your health benefits are? And, is it clear to understand? That sort of thing, because that can be overwhelming, and that can really prevent a person from seeking out the help they need, because it's just too much to understand. And then how effective is the support that you provide employees? Are there ways to track and measure that over time? So, that one's kind of pretty straightforward, but just making sure that what you are providing is effective, and do you need to change it up? And then are they familiar with the support that exists, and are they finding that there's something right for them? Again, that's just, keeping in mind that having that holistic view of your workplace and understanding that it is diverse and different people have different needs, and everyone's going to want, a therapist isn't what they need, but maybe having some access to a mindfulness app or something else, having different options for different people at all the different stages of a mental health path and journey, because like I said, there are ebbs and flows, and not everyone needs the same resource at the same time.
Absolutely. And I think the biggest takeaways, Dana, from this list is that any, excuse me, taking away as many barriers as possible, right?
Mhm.
So providing that access. If it is an EAP, as one resource, is there a password associated with it? Where is this
Mhm.
information listed? I heard of an employer several years ago, pre-pandemic, that posted their EAP information on the back of uh, employee ID badges. So
Mhm.
it was always there. It was always accessible. Um, but also really continuing the communications, that it can't just be at onboarding. It can't, these
Mhm.
resources can't just be given at onboarding or can't just be given at open enrollment, that it really takes ongoing communications. And as you just said, different types of resources provided, and giving that information out continually
Yeah.
makes a big impact.
Right. And because you never know when somebody's going to need it. And, it might, even if it's someone, not needing it at that moment, it might spark something in their mind that, oh, maybe I should do this or I should look into this. And it could be a preventative measure as well.
For sure, for sure. Okay, so moving on, Dana, the best practice workplace programming.
Yeah, so this is a list of some of the programming that we provide at FHA in Sheboygan um, to workplaces, and I would say some of the best workplace cultures for mental health in our area are utilizing a lot of these. So when we say customized mental health education, we often go into workplaces and give a brief presentation on what we call before stage 4. So when you think of mental health and comparing it to a physical ailment, if you're sick with something, you start treating it before you're at stage 4, and in a crisis or in a kind of a fatal situation. So that's what we want with mental health. So we look at the signs and symptoms and how to recognize those and what you can do at those different stages. So that's a training that we provide. We provide training on anxiety and depression and different things like that. We do mindfulness lunch and learns. So we'll just go in and give some sort of, high level mindfulness practices, nothing too in depth, but that people can incorporate into their day to day throughout work. As I mentioned, the peer support facilitator training will train employees to be facilitators for peer support groups. We do suicide prevention training, which the method that we have is QPR, question, persuade, refer. So we'll go in and train workplaces with that. We help to start up BRGs or ERGs, or give some guidance and support on that. We do customized employee screening links. So on one of the following slides, we'll give the link to the national screening, but we can do customized links. We have done this for workplaces, so they can see, it's still anonymous, but they'll see like there's a high level of anxiety within the workplace or things like that. And then we'll do policy and procedure review to see if your procedures are, have a strong mental health basis to them. So we'll look at your policy and procedures. So those are just some of the things that we will provide and some of the things that you could incorporate at your workplace.
This is really wonderful, and I think employers and organizations are always looking, to provide more resources,
Mm-hmm.
but also being empowered through these different trainings, employee
Mm-hmm.
resource groups, and with your expertise, this is so essential right now.
Mm-hmm.
It really
Yeah,
is.
and it shows, how much more there is to do besides just providing the EAP or, the health benefit package. So there's a lot more that you can do.
Absolutely, absolutely. So a question did come in: would an on-site behavioral health therapist be covered through the employer's insurance carrier to have them there, or would this be an expense that falls under the wellness program? That's a great question.
I think that really depends. I think that can vary a lot from workplace to workplace. I think um, I've seen it where it's part of it's like either free to attend if you're going to the behavioral specialist on site, or it's a more like a nominal fee. Same with like a nurse, a workplace nurse practitioner. It's like a $25 fee or something, or copay, something like that, where it'd be a lot less expensive than what it would be to go to an outside resource. But I think that really varies based on what the company's health insurance plan is and how they want to integrate that into their workplace.
For sure. I could certainly see it both ways. And I mean, even comparing it to a nutritionist, often carriers have 2 nutrition visits covered uh, in their policy. So it could be comparable to that. But also it brings to mind telehealth and really the rise of telehealth over these past 2 years, and how that is really gives greater access for individuals. And that may be another route. If it's not on site, it's access to telehealth over the lunch hour, let's say, or during a break.
Yeah, definitely. And yeah, it really opens up to when and where you can see somebody, and it's still virtual. So you're still meeting face to face typically from what I've seen, and it's usually a less of a wait time. And then with an EAP, you can often get a telehealth visit. And usually with the EAPs, the first 3 to 6 visits are typically free of charge for the employee. So that again does vary based on the program that you have, but it's usually 3 to 6.
Wow, that's wonderful also. So we have one last poll in today's webinar, and let me go ahead and launch this. We want to hear from you. What do you feel is the most important thing that or aspect of culture to reduce the mental health stigma in the workplace? So you can only choose one of these, but what's most important to create a healthy culture, to create one where mental health is normalized and part of the conversation, and part of really the day-to-day, and reducing that overall stigma? So is it leadership example? Is it ongoing communications of normalizing, again, mental health, the resources, the trainings, etc.? Is it management training or other trainings that Mental Health America provides, mental health first aid, or is it increasing access? I was hoping this would be the answer. Okay, we're going to give this about 5 more seconds, and then we'll go ahead and close, and I'll show the results here. I agree with those. But Dana, I want to see your take. 50% say leadership example is the most important aspect to reduce the stigma. What do you think, Dana?
Yeah, I would say that in a workplace, that's definitely the most or the top, of importance, because again, it really goes to inform and indicate what that culture is, and how employees feel about accessing or asking for help. But then the ongoing communications being second, I think that that's in line too, because like we've talked about, people need to know, what's available, and it's gonna be important for different people at different times. So making sure that's pretty constant communication of what's out there is really important too.
Absolutely. Absolutely.
Management training is also very important, for managers to know those signs and symptoms to look out for with their employees at that sort of mid-level, because leadership, it's important to have their buy-in, but they're not interacting as much with all of the employees.
Absolutely. Absolutely. And the managers have that day-to-day. Day-to-day. Okay. Dana, did my slide advance?
Yes, it did. We're on the workplace resources now.
Okay. All right. And again, we're in our last section here of presentation. So any questions that you would like to ask, any comments of what is working best for you, please feel free to drop those in. So Dana, if you could, we're going to highlight now the workplace resources, and there's so many right now, but I'll turn this over to you to discuss further.
Yeah, so we just highlighted a few of the top ones here. So we have MHA National. I think if the slides are sent out, there should be a link in there. But mhanational.org is the website. They have a ton of resources. This is where the Workplace Wellness Report comes from, or the Mind the Workplace report that we went over. There's other workplace resources on their website. You can take the screening there, which we actually have linked in the next slide, but that's where that mental health screening is. The 24/7 crisis text line. So that's just a text line that if you're in a mental health crisis, you can text. If some people prefer that and more comfortable with that over talking. We have BetterHelp listed here. That's just one of those telehealth or virtual therapy options. There's also Talkspace, there's Cerebral, but often if you find that you're reaching out to a therapist in your area and there's a long wait time, because that's pretty common right now, you can typically get in with BetterHelp or Talkspace or one of those within a couple of days. Usually is the wait time for those. So it's a lot faster if you feel you don't want to wait for a therapist. And it's kind of a good middle. If you really do prefer a local therapist, you can at least do that in between for waiting. And then we have the suicide prevention line, which just wanted to highlight that it is changing to 988 on July 16th. The suicide prevention line will become 988, so just like 911. But this is to kind of help try to alleviate some of those mental health crisis calls from 911 and pushing them to 988, where it's all mental health crisis calls. So that'll be switching over, and it'll be easier, a lot easier to remember than the full prevention line number that we have right now.
Absolutely. That's going to be very resourceful and helpful when that comes out, and hopefully well utilized, because it's easy to remember.
Right.
One other resource that I actually used is Psychology Today, which will therapists can list their services and if they have openings at this time. And it may just be a way to have quicker access, along with BetterHelp.
That's a great one too. And they also, on that website, they will list too if they will do virtual options. So I'm in Wisconsin. I don't know where everyone is on the call, but if you go to Psychology Today and find a Wisconsin therapist anywhere in Wisconsin and they do virtual, you could see them because they're licensed in the state. So, you could find people, a broader range of people. So maybe quicker availability that way.
That's good to know. Oh shoot, did I skip a slide? I didn't. Okay. So the screening, which is wonderful on the MHA website, is such an important screening tool. We've had employers actually link to this and use this in their wellness program.
Yeah, it's really important. It's pretty simple screening. It takes you through a set of questions, and then at the end, it will give you kind of a score. If you are scoring moderate on anxiety or depression, severe, low, not really experiencing it, you're pretty good. But then it'll also give you some resources too. So it's just a really good way to give you an indication of what might be going on. If you're feeling a little off, like, is this something I need to be concerned about? And like you can see here on the slide, 1 in 5 people will have a mental health condition in their lifetime, so it's not uncommon. And the sooner you can address it and treat it, the better off you'll be. So we really suggest just taking the screening pretty much at any time, even if you aren't feeling like anything's wrong. It doesn't hurt to take it.
Absolutely.
And then we have here reaching out to MHA. If you have any questions about workplace trainings, workplace wellness programming, anything like that, even if it's not for us to come in, just questions about workplace wellness, we're happy to help you.
Absolutely. Okay, we did just have a question come in. Are there any good wellness apps that are free to use? I know Teladoc and Headspace are not. Do you have any, Dana?
So like an overall wellness app where it provides like you can get therapy appointments and things like that? Well, I don't think there are any.
I can't think of any that are. I agree. I'm just trying to think through. There's many resources out there. They're truly that are free, but I don't know of ones of one app.
If you're looking at like the mindfulness apps, there's all of them typically have at least a component that's free. So like Calm and Headspace, any of those kind of meditation apps have, you know, a certain degree of free usage, but then if you want like all of the functionalities, then you have to pay a subscription. I don't know of any totally free ones out there really, but yeah, you can probably dabble in a few different ones and get a collection of things. But if you want that easy access, I don't know of any that are totally free. But I mean, I think playing with those different free portions of apps, and you can find what you like, and then see if any are worthwhile for you to subscribe to.
Absolutely. And I think checking with your carrier, with your insurance provider, even checking with your insurance broker, if you use one of those at your organization, there are, again, so many resources out there today. And even going on the MHA website, there are many resources for the workplace as well.
Yeah. And you can sometimes sometimes your insurance company will provide you with like a discount to some of the apps too. So that's something to look into.
That's good. Yes, absolutely. So another question is, how important do you think it is for supervisors or HR professionals to go through mental health first aid training?
I think that's very important to have HR, all of HR, and really any manager or supervisor should go through it, whether it's the mental health first aid or some other mental health training, because like I said, these are the people interacting with employees day to day. You're engaging with them and seeing, you know, any of those kind of nuances or, you know, variations from their kind of normal behavior. So I think it's really important, and it teaches you too kind of how to discuss these things, because it's not always easy for people to talk about and bring up. So it'll give you some good ways to begin that conversation. And I think that it's really important for all management and supervisors to have that training.
Absolutely. I agree. I think it's something, again, as we discussed, they have the most connection or the most direct access to employees and interaction. So they can be first to notice. And I think it's worth noting that mental health first aid, it's not, you're not giving first aid. You're not giving the solution. You're not giving treatment. What mental health first aid is recognizing when someone may need assistance and directing the individual to a resource. So, yeah, I agree. I think that middle management, as you said, and HR is critical. Okay, so we have another question. Our EAP has an app called RxWell that offers mental health tools and stress management techniques. It's not an additional expense either. Oh, that's wonderful. Thank you for adding that. That is very interesting. Have you heard of RxWell, Dana?
I haven't heard of that one. There's one I've heard of called MD Live, and they do have mental health resources, and as well as medical doctors, and I think you can even do like dermatology and different things. But I haven't heard of the RxWell one. So I think that there are some out there. So that's why I think it's worthwhile checking with your insurance, because sometimes they do have like a partner app or program that they have it's included within your benefit package.
Absolutely. And again, I think it goes back to as well what you mentioned earlier is to provide different resources, provide a range of resources. There is no one answer, and you don't know when the employee needs it, right? Or the spouse or a family member. So providing a good variety and continuing that communication, having that touch point is so important. Okay, wonderful. Thank you all for your questions, your comments. We have a little bit more time, so if you have more, please let us know, roll those in. Just a little bit about Motion Connected. Motion Connected does partner with Mental Health America for resources and assessment. So right in our app, when we talk about access and being able, when a family member, a spouse, or an employee needs assistance, picking up the app, not having to go to HR, not having to call the manager for the EAP login or access number, giving the individual the access to at their fingertips through the app is so important. So we have a bulletin board which can house benefits information, but also we have a lot of learning resources and education as well, in partnership again with MHA, that really delivers needed content to individuals' fingertips, right? And really, again, trying to bridge that gap in providing whole person well-being, in educating individuals in their benefits, but also how to access and creating that ease of use. So again, thank you all for joining today. Dana, thank you. If you have any other questions, please feel free to drop those in. Everyone will receive a copy of the slides and a copy of this recording. And if anyone is looking for more information on Motion Connected, please feel free to reach out to us. And if anyone is looking for more information, absolutely. I want to take this back a couple slides to the many resources that MHA offers and trainings. Absolutely reach out to your local MHA, reach out to Dana at Mental Health America, Sheboygan County, and really, this is such a needed, necessary conversation to continue having beyond Mental Health Month. So,
Yeah.
All right, I don't see any more answers coming, or I'm sorry, questions coming in. All right, Dana, thank you so much.
Thank you for having me.
Your time, your energy, and all the wonderful work that you all do at MHA.
Yeah, thank you.
All right, thanks everyone.
Bye.
Bye.